Hi, my name is Carrie Zepke, and I am a Doctor of Athletic Training candidate at A.T. Still University, and this is my applied research project titled Implementing Diaphragmatic Breathing Techniques into a Collegiate Women's Basketball Program. And my advisor for this project was Dr. Anderson. In this presentation, I will give insight into the background of this project, review the problem, and detail how the Postural Restoration Institute can help us to solve this problem. We'll go over the study design, talk about the program that I chose to implement, go through my PDSA cycle, and of course, we'll show you the results and talk about some of the lessons and limitations that came with this program. So let's get started. The group I was working with was a team of 15 women's basketball players that compete at the NCAA Division I level. In the NCAA, a typical season runs from the end of October to the beginning or middle of March. However, basketball is considered a year-round sport due to coaches having the ability to work with players 12 months out of the year. Since this went into effect of year-round coach contact, there has been an increase of overuse injuries and added emphasis on the need for prevention programs. Since I have begun working with the women's basketball program at the University of Northern Iowa, I've noticed a high number of lower back and lower body injuries. Most noted were lower back soreness or tightness, hip injuries, hip flexor, quad, and hamstring strains. I was spending a large amount of time in treatment on these injuries, though they were never seen as a large issue due to most of them not requiring the student athlete to actually miss any playing time. Breathing and diaphragm exercises are often overlooked aspects of training and warm-up that can provide a significant impact as injury prevention exercises. Many dysfunctional movement patterns occur because the body is unable to create synergistic movement due to ineffective contraction of the diaphragm and subsequent reduced core stability. The long nature of the collegiate basketball season necessitates the incorporation of these simple exercises into warm-ups or strength and conditioning workouts to provide effective injury prevention programs. In college basketball, muscle strains are very prominent. Lower back pain has become an increasing issue, with a lot of notice being put on insufficient use of the musculoskeletal system and muscles not working synergistically. Prevention is key to the practice of most collegiate athletic trainers, and utilizing breathing techniques to help with diaphragmatic efficiency could be the answer in helping to prevent non-acute lower back pain in collegiate women's basketball. The Postural Restoration Institute suggests that when the diaphragm is utilized efficiently and to its full potential, the effects can be seen throughout the entire body with increased endurance, increased range of motion, and better synergistic movement throughout the musculoskeletal system. The PRI approach stresses that the human body is not symmetrical. The neurological, respiratory, circulatory, muscular, and vision systems are not the same on the right side as they are on the left, and thus these systems have very different responsibilities, functions, positions, and demands placed on each side. The human body thrives off these asymmetries and is balanced through imbalances. One of the main purposes of the PRI techniques is to recognize these imbalances and the typical patterns associated with system disuse or weakness that develops because of dominant overuse. For this special project, I used a PDSA, or Plan, Do, Study, Act design. The main measurement of my project was whether or not it was implemented. I chose this as the main measurement due to only having 12 weeks to implement it and collect some sort of data. It just wasn't enough to give us good injury data, being that we were putting it in the middle of a season. I personally instructed each athlete individually how to perform the 90-90 hip lift, the PRI wall-supported squat, and the standing serratus squat. These were chosen based on the ease at which they could be performed and them not requiring any equipment for them to be performed correctly. The first step of the process was planning which exercises we were going to use, as well as recruiting some other health professionals or coaching staff that could help to make sure that the student athletes were performing everything correctly, especially if we were going to do it in a large-scale group. That was going to be very important, just for supervision purposes. From there, once we got all that decided, I taught the exercises to the athletes. This was a little bit challenging since we started the program mid-season. We started in December, but we wanted everyone to start fully at the same point. From there, the exercises were put into the warm-up routine, and then through the PDSA cycle, we moved it to the weight room as part of that sequence. And then ultimately, we did it as part of the players' pre-practice routines where they came into the training room and performed the exercises more on their own time prior to going to practice. For the study portion, I was looking at the ability of the athletes to perform these exercises and perform them correctly in the right environment. This is where we noticed that when it was initially put into the warm-up that it really didn't get done correctly. The athletes felt rushed trying to get through it so that they could get to practice because the coaching staff was waiting on them to finish it. And doing these exercises appropriately is one of the biggest things in implementing this successfully. This led to 3 stages, and eventually ended, as I said, with the athletes doing the exercises on their own before practices or before games, which, as we'll talk about in the results, actually wound up being kind of a blessing and worked out a little bit better for us. The results of this project were very positive. We had 15 athletes complete 7 sessions per week for 12 weeks. During this time, the coaches and the players gave great feedback on the program and how much they enjoyed it. The players were even wanting to do it on their days off, which made us put in a virtual component to making sure that it was being done correctly. The results for this are a little different. Since our primary measure was implementation, we saw that it was successful. The project was deemed successful. However, we didn't really measure a lot of specific data due to the small time frame. We just didn't have enough time to look at specific injury data just because it was the middle of the season and there were too many variables. But superficial results did show that we had a decrease in the amount of treatments of these injuries that we were looking at. There were a lot of things that I learned as we started going through the project that I think could have made it a little bit better. One of the main ones being using some kind of patient-reported outcome measure. I think this could have been very helpful for determining how well the program was liked during each stage that it was implemented in, as well as the ease of the program and how the players were actually feeling other than just word of mouth. So that's something I would like to put in the future. We had 2 pretty big limitations that we had to deal with. The first one was just the timing. We implemented this program in the middle of the season in December, and getting everybody trained in the middle of the season on the exercises and making sure they were doing them correctly and still trying to get everyone to start it on time was a little bit of an issue, especially because we were trying to do one-on-ones between me and the student athletes for the training purposes. So I think going forward, being able to do that at the beginning of the year will be helpful. And then also them not trying to do it in a full group atmosphere makes it a little bit easier also. COVID-19, as with everything right now, was a big hurdle that actually wound up helping us get to the conclusion of doing the program individually versus in a group setting. We found it was very easy to do virtual check-ins, and the athletes were able to do this at home and help with their rehab that way. And we were able to kind of come to the conclusion that this is something that could be done throughout the summer. It can be done at any point in the process. So it actually wound up working out for us, but it was something we had to overcome initially, trying to figure out how to do all the check-ins virtually. So as I said, this program was considered as implemented successfully, but there are a lot of future implications for this program that I'm really excited to continue and explore. The athletes have expressed interest in continuing the program, and I plan to collect better data over the next season or two to really help determine its effects on injury prevention overall. So I think there's big things to come from this project still, once we have a little bit bigger of a time frame to use. Thank you for taking the time to listen to my presentation. I look forward to hopefully sharing more information on this project in the future.